nothing is not an option. We're going to have some kind of health care reform in this country. So without further ado, I'd like to introduce to you the Speaker of the California Assembly, Ms. Sharon.
Going to let the right-wing fringe hold back this train to reform health care in our country and to make the United States like every other industrialized country on the planet. How is it that we are the richest country on the planet and we can't figure out how to provide health care for our population? There are many countries on the planet that don't have anywhere near the wealth that our country has. But somehow, because they have the will, because they have the commitment, they have decided that there is no one in their society that will be without health care, and I think it's high time that the United States do the same thing. What do you think? Talk to you for a few minutes because healthcare is a very important issue for me. It's obviously an important issue for everybody here, but for those of you that know me, you know that I've been active in the community for pretty much all my life. But before 1990, before I started the Community Coalition, I worked in the healthcare field. I started working in healthcare in the 70s as a nurse. I worked in the neonatal ICU unit with all the premature babies, and I worked at most of the hospitals around town, from County General to Wright Memorial to Children's Hospital, working those 12 and 16-hour shifts with babies that were born underweight because of moms that didn't have prenatal care, with babies that wound up costing society hundreds of thousands of dollars. Now that was 30 years ago. Now those same babies cost millions of dollars. Why? Because there wasn't the preventive health care that the mother had access to. After I left becoming a nurse, I became a physician assistant, a PA, and I worked for years at County General Hospital, trauma unit. And I worked there and I saw people come in and I saw people sometimes die right in front of you. And why? Because they didn't have health insurance. When I would work 16-hour shifts, a lot of my patients, by the time they saw me, had already been in another hospital for 8, 9 to 10 hours, only to find that they had no insurance, and then they were transferred to county while they waited another 9 to 10 hours with broken bones, with lacerations, with limbs partially amputated because they didn't have health insurance. And I think that that is a criminal in our country at this point in time to still not having resolved that problem. As Anthony Samad said, well, the other day we lost a hero in healthcare, someone who devoted his entire life to healthcare reform. And it's so sad that he didn't live to see it happen. And it kind of reminded me of Obama's grandmother. You remember how she lived long enough to vote for him, but didn't live long enough to see him win. And Senator Kennedy lived long enough to see him win and long enough to see him start healthcare reform, but not long enough to see him finish. And so to me, that left all of us with the challenge to fulfill his dream and a dream for all of us as well. Causes of death in the African-American population that are disproportionate, sometimes double that of the white population, and those statistics could be normalized if there was preventive health care and also if there was access to health care. The idea that in this country that you're only eligible for a health care plan if you have no problems, but if you have any kind of problem, that's considered a pre-existing condition and you're ineligible for most health care plans. You can even get a health care plan and a year later be diagnosed with something like breast cancer, like you've heard the president talk about his mother, who was diagnosed as with breast cancer and died of breast cancer. And at a certain point, they wanted to cut her off insurance because they said, why didn't you know you had breast cancer? Well, what's the point of having health insurance if the minute you actually need it, you get canceled? And so that's what this plan will eliminate. Pre-existing conditions will no longer be a reason to deny